Good to have you with us on this Friday edition of The Urban Debate. We begin by focusing on key cities in India where COVID has come back into focus. Viewers, as had been warned many times, it is now happening that because of the festival season where people ignored the COVID norms and openly violated the rules, crowded in various places, a jump in cases. We have repeatedly told you about the health emergency in the national capital. But take a look at what could be happening in many other cities as well. If this is how people continue to throng in public places without any safety, without any precautions. And it's not just the visuals. They tell you a very horrifying story of what is coming next. But I will also show to you statistics of what is happening right now. In Delhi, as you know, the death toll on a daily basis, we're reporting 90 to 100 to 130 deaths. There is now a waiting period at the crematoriums in the national capital. That's how bad the situation has become. The crematoriums are not able to even take this load. In Ahmedabad, a weekend lockdown has been announced. It's been many weeks since any city went into a curfew, even for a day or two. We had pretty much forgotten that practice, moved beyond the state of lockdown. But in Ahmedabad, starting tonight, because of the recent spike in cases, there will be a lockdown. Look at that. Now, in absolute terms, you may think the daily number around 200 isn't that much. But Ahmedabad last month had been reporting cases in the range of 135 to 140 or 150. So this is a large number. It's still far away from its peak when it reported over 300 cases. But the authorities have gone into damage control mode already. Additional health infrastructure is being put into place. Mumbai has seen a ramping up of testing. The cases, daily cases are really swinging because the testing that's happening on a daily basis is also inconsistent. The number of tests that are being conducted are varying from 5,000 to 15,000. But there is a sense that precautions need to be taken and alert need to be sounded off, not just in Mumbai, in Pune as well. So we're going to first go across to our reporters on ground. We'll get you ground reports from different cities. We also have experts who will be joining us right now on what the policies should be in various cities. Disha Shah has been reporting for us from Ahmedabad. I've also got Ayushman Kumar joining us from Delhi. Ayushman, let me begin with you first. In Delhi, steep fines, not just for not wearing masks, but all kinds of violations now. Well, what are the various steps that the government is now taking?
Well, Tanvi, today was the first day of house-to-house survey. This was discussed in the meeting with the MHA that the government will do an extensive house-to-house survey, and that has started today. And to our surprise, a quarter of Delhi's population is going to be surveyed by a team of 9,500 teams have been formed, each team having 3 to 5 members. Apart from that, Tanvi, today the Delhi government earlier had announced that it will be only mask, but the government order which has come right now, it says it is not just for the mask, but even for spitting in the public places, chewing pan and gutka, not observing the quarantine guidelines, and not following the containment norms will also draw rupees 2,000 rupees fine. The government is trying to restrict people movement outside and even tell them to follow the COVID guidelines, COVID appropriate behavior. The Chief Minister met today the Market Association members. He said that mask is mandatory. How much of that is going to be followed, that has to be looked. But for now, Delhi is extensively planning to do a house-to-house survey in the containment zone and the densely populated area, which has quarter of Delhi's population, about 58 lakh people are to be surveyed, Tanvi, in which the isolation of people who are having influenza-like illness symptoms is to be done so as to contain the number which is going to come. Though the Delhi government is confident that the numbers from here on will go down, but the health ministry says that the RT-PCR rates are going to go up and the testing is going to be increasing, and severity of cases in the national capital will increase, and that is why it is very important to augment the health infrastructure and COVID ICU beds, and that is why you can see the government ramping up every effort, but on ground, punitive action to be taken against anyone who is found to be violating the guidelines of face mask, COVID appropriate behavior. 2,000 rupees, a hefty fine to be imposed in national capital for that, Tanvi.
So 2,000 rupees fine is now not just for not wearing a mask, but it is also if you don't maintain your distance. It is also if you spit in public and various other regulations that have been put in place, steep fines being brought in. Ayushman, stay with me. I want to come back to you on another aspect, but let me also go across to Disha Shah, who's joining us from Ahmedabad. And Disha is actually at one of Ahmedabad's famous cow gullies, which would in normal times be extremely crowded by Friday evening. This time, Disha, what are you seeing right now?
Well, Tanvi, it's just less than an hour for the weekend curfew to be imposed here in the city of Ahmedabad, and we are here standing at a very famous spot which is called as a CG Road, and this behind me, what you see is entire cow gully. You can see just an hour before the lockdown, most of the shops are just closing their shutters, and you can see very limited, I mean no crowd at all. Usually, Tanvi, this place is so crowded, so full of people always till about 11:30, 12 o'clock. This entire parking gets full. There are people who are just, either shopping, eating famous delicacies like jalebi fafda, which is the main and very famous here in Ahmedabad. But right now you can see people are just packing their stuff because of the weekend curfew, which starts at 9 p.m. tonight till about Monday morning 6 a.m. On the other side of the road, these are the famous stores that you see. These stores usually remain open till about 10 p.m., 10 to 10:30 p.m. because of the festive season and even otherwise. But right now you can see half shutters are already down because the curfew starts at about 9 o'clock. So this is the famous road. If you can ask my video journalist Moju to show, it attracts a lot of vehicles all the time. But right now you can see very limited vehicles on the road too. So this is primarily because of various reasons that the government had to impose this lockdown. First and foremost, markets, because during festival, a lot of people went to the markets. They were seen not maintaining social distancing norms, not wearing masks, and that is why for a city which was reporting only about 110 cases, 120 cases daily a month ago, suddenly it is witnessing about over 250 cases, and that is why it is concerning the administration. And in fact, today the latest number says that the city here in Ahmedabad has reported 305 cases, which is the second highest since June this year. So that is why this is needed. In fact, in the next, of course, weekend curfew, what we understand, only medical shops and milk stores will be permitted to remain open. Otherwise, no other shops will be allowed to remain open. And from Monday onwards, then a night curfew will be imposed. That is from 9 p.m. to 6 a.m. till further orders. And this is only to spread to curb the spread of the infection in the city.
Yes, and I want to just highlight one aspect which is very unique to Ahmedabad in terms of the rest of the country. Ahmedabad already has a very high mortality rate, which is why you're also seeing authorities move faster, because they don't want to look at a situation where you see a larger number of deaths as the winter season also intensifies. Disha, thanks so much for getting us that update. Ayushman, very quickly to you. On the aspect of testing, you said they will be ramping up RT-PCR tests. Delhi right now together is conducting, about 60,000 odd tests on a daily basis. But what percentage of this is RT-PCR? How quickly will this be ramped up?
Well, Tanvi, as per the MHA, by Monday, we can expect the numbers to increase. Currently, it is 18,000 and that has been improved till 20,000. We are expecting it to go to 27,000. This is what the health minister today said. And it can be ramped up to 40,000. But this is what the ICMR sources are telling us. But currently, if you see, Tanvi, like if I can quote the figures from November 10 to November 16, which we have got from our sources, it says that of the overall tests that Delhi conducted during this period, only 38% of the total tests were RT-PCR. But if you take the total number of cases, 65% of those cases came from that 38%. Now, rest 62% of antigen only contributed about 35% of the cases. The case detection ratio of RT-PCR is very high in the national capital, which clearly signifies that it is very important to ramp up the RT-PCR numbers, and that is what the MHA has also instructed it to double the number of RT-PCR and also have the rightful mixture of antigen and RT-PCR. Delhi has been over-dependent on antigen, and that has been the matter in the High Court, and that is why the High Court has slammed the Delhi government for many weeks now. But if you see the current context, Centre has stepped in. ICMR has said that they are going to roll out the mobile vans. So it is expected that by next week or so, we can expect the numbers to go up to 40,000. But in the near future, it will be ramping up to 30,000, Tanvi.
All right, Ayushman and Disha, thanks so much for bringing us those updates from these two of the key cities. We'll also talk about Mumbai and Pune. In fact, I also want to let our viewers know that it's not just a problem in these few cities. Even if you look at the number of cases being reported in cities like Indore, which were in the initial period a huge problem, but then got a good control of the COVID cases. There also the numbers have now begun to go up. The slump that you see, and this will be a pattern in most cities, is because over the Diwali weekend, the testing actually went down. So as the testing reduced, the numbers reduced, but otherwise, look at the high number of cases being registered in Indore. Similarly, Jaipur is another city, and Jaipur too will be witnessing colder, harsher winters as we go along, and this could then become a problem for Jaipur as well. Faridabad as well is no different from the national capital. There also this problem exists, just like Gurugram, Noida and Greater Noida. So many cities now need to be on high alert, and you and I need to remind ourselves that it's not time yet to forget the COVID norms. Let's say good evening to Dr. Dilip Malvankar, Director for the Indian Institute of Public Health and a member of the COVID-19 Task Force in Gujarat. Dr. Achal Agarwal, co-founder for Cove India, joins us this evening, and Dr. Om Srivastav, Director for Infectious Diseases at Jaslok Hospital and Research Center, member of the Maharashtra Task Force with us. Good to have you back, Dr. Srivastav. Let me actually begin by asking Dr. Achal Agarwal, the trend that we are seeing in some of these cities, and you would be analyzing the numbers, is it a direct factor or just a factor of higher testing? Is it also about COVID norms being flouted? How do you read the statistics coming from these cities?
Right, so there are three things mainly that I'd like to point out. Firstly, as you have already mentioned, the Diwali effect. So we have seen that, so 1 week after Diwali, so Diwali was last week, and we have seen spike in numbers in some cities like Mumbai and Pune just recently. Right, so this can be attributed to Diwali. There's another effect of, as you mentioned again, was cold and harsher conditions. So coronavirus is kind of similar to flu. So it requires cold and dry conditions to survive longer. Right? So this has been seen also in Europe currently. And some of that effect is what we are seeing in India, because in colder weather, right, especially in North India, you see harsher winters, and that is creating an effect. Thirdly, and most importantly, in the case of Ahmedabad, the numbers are absolutely false because it's not possible. So the numbers have been perfectly constant for about a month. So that changed 15 days ago, but probability wise, there's a very small probability that the numbers could be so constant, and they've reduced the number of testing by half in Ahmedabad. So it is the numbers don't make sense, and I think the recent panic we are seeing in Ahmedabad is because they have been taking it lightly and not reporting the right numbers, and now the realization has come that things might go out of hand, and that's why the weekend curfew has been imposed. Because
actually, Dr. Agarwal, the point that you made about Ahmedabad, and we've noticed this, we used to do exhaustive number crunching and data crunching in the first 6 months, and for the city of Ahmedabad, for most of that time period, it was pretty much a plateau. Active cases, yep. Fresh cases, that line never changed, and it also made us question about what is it that was being reported. But if we see the response of the authorities right now, it definitely looks like there is something on ground that they know that is alarming them right now, isn't it?
Right, because the test positivity rate currently in Ahmedabad is only 2% as per the reports, right? So 2% is very low compared to Delhi, which is at 12% right now. So 12% is a cause for concern, but 2% is no cause for imposing a weekend curfew. So clearly the numbers, actual numbers are something else which the government knows and they're responding accordingly. Thankfully, at least they're responding accordingly. But the numbers that we have, at least for the case of Gujarat, it doesn't make, we can't really analyze those numbers. So we have to take them with a pinch of salt.
Okay, let me bring in Dr. Dilip Malvankar, then Director for Indian Institute of Public Health, and he is a member of the Gujarat Task Force. Dr. Malvankar, what's happening? And while Ahmedabad will be going into a 2-day weekend lockdown, which honestly speaking, the last couple of months we've not seen anywhere in the country, other cities have also brought back the night curfew. Now, what is happening to your experience, in your mind?
Tanvi, if you remember some days ago or weeks ago, we had this program where around Ganesh festival in Bombay, we saw the crowds, and similarly crowds in the markets, as well as the coming of the winter, which in Europe we had clearly seen a month and a half ago, the peaking of cases, which were even more than what happened in April in Europe. So in some sense, it is predicted that in winter the cases will go up. And with what we saw on the markets, and people, I think, also getting complacent, because in between there was phase where the cases were less, deaths was, mortality also came down as compared to April substantially. So a lot of people thought that COVID is now gone or will not come back. And that is where this Navratri, even though Navratri festival was not celebrated, the Garba were not allowed on large scale, but the festivities were there. And now Diwali and pre-Diwali shopping, what we are seeing is, I think, the effect of that. So I think we have to be extremely careful, and winter is just beginning in Gujarat. It's not like Delhi. Temperatures are still quite not so low. So as the temperatures go lower and we see maybe rise, so that's why government has imposed this curfew, because people are not following voluntary distancing, even masks. If you remember the shots which we saw earlier where shops and establishments had circles made and people were standing in those circles, all of that was forgotten in spite of repeated reminders. So people somehow got this impression that the virus is either low or gone or will not affect them. And that's what has proved to be very detrimental.
Yes, absolutely. I think, maybe there's also a fatigue factor, but honestly, it can't be a reason for risking your life. We don't know too much about COVID. We are still learning, but there are more and more reports that suggesting various kinds of impact. There's, psychological impact that now several reports have, research reports have spoken about. There is also a long-term possible damage to your organs that, now many reports seem to be suggesting across the world this is being noticed. Dr. Srivastava, which is why it becomes important for us to remember that right now our only weapon until there is a vaccine or a drug that can give us immediate relief, our only weapon against COVID is distancing and mask. Now, how are you reading the numbers that are coming in from various cities? Could it get worse? Will it be okay to say at this rate we are headed for a second wave?
That's a very likely scenario. I think that, why is India going to be any different to any other country in the world? If you just look at the numbers, out of the 10 countries with the maximum numbers, 7 of them are coming out of Europe. 7 of them are from Europe. And the numbers coming out of Europe are such that they are 2 times or 3 times what the numbers were when the COVID first wave was identified and started. So why would India be any different? The winter in some parts of India is very harsh, northern India. The winter in places like Mumbai is not that bad, but that there are factors of humidity, social distancing, and the amount of droplet that is circulating or floating in the environment. So all of that will come into play. We have no real option but to be cautious up until such time as it is clearly evident that the numbers of COVID are receding. And until that time, the only things, as you've already rightly pointed out, Tanvi, is to make sure that you're keeping your social distancing and you're wearing your mask. But as has been already also elucidated, we don't seem to be learning our lessons, and we're not learning it from other people's mistakes. So if that is the case, then we're probably going to have to learn these things the harsh way. We also know from the audits at one of the state level in Maharashtra that the biggest outbreaks have come from clusters of 20, 25, 30 people. So that once we know that, there is a role for pointing that out to people that a gathering of any more than 3 or 4 people, if it must be done, it must be at social distancing in the norms that have been laid out. Unfortunately, I don't think that you can impose this over a very long period of time. And at some stage, the message will have to go through to the common public that this is a prayer to see for their own safety how much they can minimize social interactions, even though they might be fed up. It's still not worth paying for this kind of a misadventure with your life, or unfortunately being hospitalized or going into an ICU or a ventilator.
What's happening here, in Mumbai, Dr. Srivastav? Because I was looking at least the last 10 days data, the testing numbers are all over the place. So I don't know what to make of the cases that are being reported. What is your analysis?
Well, I think, look, this is something that I have said from the beginning. We are not testing enough. Okay, we should be testing at least 5 times these numbers. Now, I know it's easy for me to say testing requires the manpower, the infrastructure, the turnaround time, all of those things come into play. I realize that, but it's not enough. We need to test, we need to screen, we need to isolate, we need to go into the community transmission. We need to look at all those things. Unless you are able to find there is a large number of population of people who would be infective and shedding the virus, who may be completely asymptomatic. It is that population that you need to be identifying. So the only way you're going to identify an asymptomatic shedder of the virus is by testing and testing again and testing again. There's no other option. You simply have to go from door to door, house to house. Now, again, I realize that that's a tall order, but it will need to be done. So numbers-wise, look, I think you're right, Tanvi, in that it is all over the place. It needs to be more structured, more streamlined, and that needs to be broken down as to what was the change in figures of these people who are infected between last week and now, and where that could be headed. So all of those things can be done in a mathematical model, but for a mathematical model to work, you must know what are the number of people who are affected in the community. And therefore, you need to test them.
Right. Dr. Agrawal, would you like to come in on this as well?
Right. So one thing I need to mention is that transparency of data is very, very important. Yeah. So mathematical modeling, there's a huge bunch of community of data scientists waiting to sit there and help you with mathematical modeling. But for example, the testing data in Bombay and Pune, for the last 1 week, there is no data. Right? So we have to estimate and give some estimation. It will be very helpful for everyone, and even for the public, right, to be well informed of what the actual statistics are. And also give confidence on the government that yes, they know what is going on there and it's under control, because no data means people make up all kinds of theories and maybe panic sometimes. So it's on.
So in your analysis, based on the numbers that we have right now, are we headed for a second wave?
Right. So the initial trend is yes, but we don't know if that is just post Diwali effect or not, because as Sir mentioned before, Bombay doesn't have a very cold weather,
right?
And neither is it dry. So both the conditions, cool and dry, is not there in Bombay. So maybe it might.
Okay, so now I'm talking larger, say for the big key cities and the key states that were a problem in the summers for us and saw a larger percentage of the cases in our country.
So we are currently already seeing in Delhi and in Haryana, right? The cases are going up with quite an alarming rate. And I guess as winter sets in, there's more chances that in the northern countries. So surprisingly, in the world, for example, the country with the highest cases per million is Qatar, right? All the Middle Eastern countries.
Yeah.
And that is because that the climate is so dry there. Right? So drier climate is it seems like COVID likes dry climate. And the winter in the north, it's pretty dry. So there is a chance, a pretty good chance that in the north, especially, we'll see a second wave.
Very much possible that in the north, at least because of the cold and the pollution, we see a second wave. I just also want to, because we were talking about some of these cities. Delhi, we've repeatedly highlighted, look at the number of daily cases that we are looking at right now. The testing will be further ramped up, so I don't think there will be any change in this number, at least in the coming days, as the testing and the RT-PCR test especially go further up in the national capital. But even in cities like Pune, now in the last 2-3 days, the number of cases that are being reported have gone above 600, 666 on November 18th, 789 cases yesterday. We're waiting for data that comes in today, but look at the difference before Diwali and after Diwali. Pune, for the longest time, was the worst hit city in terms of number of cases. It topped the charts amongst the big cities that we had been tracking. It finally managed to get a control and get a grip on this just a few weeks ago, and now seems to be headed back for another round. Dr. Dilip, you wanted to make a point? Go ahead, please.
Yeah, I think we have experience of almost 6-7 months of this testing and treating. I think humble submission is government should reconsider and open up testing. All pathologists who have RT-PCR machines, have the trained staff, should be allowed. Currently, it is like a license permit Raj. There are only very few pathology labs which are doing the test. There's nothing specific, nothing so special. Initially, kits were not there, people were not trained, but now we have thousands of labs which can be doing testing. It's like any other infectious disease. And similarly, even opening up smaller nursing homes to treat these patients. We are allowing treatment at home, but we are only saying, okay, this hospital is allowed, that hospital is not. So I think we have to move away from this limited testing and limited treatment facility. Let all MD doctors having hospitals wherever, even at home. Gujarat has been thinking that even remdesivir, whether we should allow that to be given at home. So I think we have to really make it, because the spike is coming, it will increase, and we will need to ramp up the facilities. And we have private facilities on a large scale in the country which are currently underutilized. So also think in that direction. Maybe in your next debate, take this up.
Yes,
that
absolutely.
How long can we have this license permit type of arrangement for labs and treatment?
Absolutely, you're right there. On one hand, what you're saying, Dr. Dilip, does make a lot of sense, that it shouldn't be restrictive. But in cities like Mumbai, people are also not coming out to get tested. BMC is repeatedly promoting and advertising the fact that they've opened up free testing facilities. Please come out and get tested. And many other civic body corporations are exploring the idea of going door to door, because I think people just now have it in their minds that it's okay to not know. If you know, then you will be stuck at home for 2 weeks, and there will be, all of this tracing and questions and answers, and authorities landing up at your place, or stigmatization. I don't know what it is, but there is some amount of hesitation from our citizens as well. Testing is the only way. More and more testing, tracing, giving us transparency in those numbers. And of course, on our end, we have to follow the norms. Wear a mask if you have to step out, when you have to step out. Take care of your own health. Thank you so much to our experts who joined us and gave their insights. It was really helpful in terms of the analysis that they've made. I want to just bring out one more specific report before we wrap up this conversation. This is how horrifying the experience has become for some of the families in the national capital. Now, as the number of deaths have seen a sudden surge in the national capital, the various crematorium grounds across the city are under pressure. And they're witnessing long queues. Relatives of deceased COVID patients are saying they have to wait for hours to perform the last rites. Here is a report that Alok got for us from the Nigambodh Ghat.
as the number of deaths are increased in the national capital, that is related to the COVID, now the problem has also started happening at the cremation ground. I am standing at Delhi's biggest cremation ground. This is Nigam Bodh Ghat, and in fact there is a waiting of around 3 to 4 hours for many people. In fact, those people who are coming with the dead bodies, they are complaining about that they have to wait for 3 to 4 hours. In fact, not only here in the hospital, also that they have to wait to take the bodies as well. Yes, there is a limited number of the cremation ground, limited number of the place where the body is being cremated. So as of now, there are separate arrangements for the dead bodies of the COVID has been made at various cremation grounds in the national capital. But despite that, the problem is happening. Right now, the government is saying that they are making arrangements at the cremation ground as well. They may increase the number of the places where the body is being cremated at the cremation ground. As of now, if we talk about this cremation ground, there are 104 places where the body is cremated and 50 are dedicated for the COVID bodies. So they may increase as well in the coming days. But right now, numbers of the deaths have increased, due to which these cremation grounds are facing the problem of the waiting. With video journalist Mrityunjay, I am Alok for Mirror Now.
Well, time for a quick break. We've got 3 more crucial topics lined up for you on the other side here on the Urban Debate. Stay with me. Thanks for joining in. We move on to topic number 2 here on the Urban Debate. Viewers, the Australian architect Paul Bartels, who was arrested by the NCB in their drugs case that they're investigating with lots of Bollywood links, he's now gotten bail. He was arrested for alleged procurement and consumption of contraband. Officials didn't find any contraband in his house. They claim they came across WhatsApp chats that spoke about these drugs. And so the court actually gave him bail. And the court ended up saying that the WhatsApp messages are not substantial and sufficient to hold role of accused as a peddler or supplier of drugs in a case. This is a very important part. This is what we highlighted to you several weeks ago. And this became a big story with Riya Chakrabarti in jail after the NCB arrested her. After the NCB put the spotlight on all kinds of Bollywood celebrities and names and started questioning them, and there were these WhatsApp chats doing the rounds, we told you then that WhatsApp chats will not be enough. That's what the Bombay High Court has said today. If the cogent material is collected by NCB demonstrating the role of the accused as peddler or supplier of drugs, then the scenario will be different. Except statements of the co-accused and WhatsApp messages, there is no substantial material to treat the accused as a peddler or supplier of drugs, and hence this man is out on bail. Now, the question I'm asking tonight is very simple. Is this a setback for the NCB in the current investigation is doing into the Bollywood drugs link? Take a look at the number of people and the names who've actually been summoned and questioned so far. There is Deepika Padukone, Sara Ali Khan, Shraddha Kapoor. All of these people became under the spotlight, summoned and questioned by the NCB. There was also Karishma Prakash, Deepika's manager, Shabana Saeed, Feroz Nadiadwala's wife. In fact, Feroz Nadiadwala also summoned. Arjun Rampal summoned and questioned. His partner, Gabriella, summoned and questioned. Now, in all of this, there are very few where there is evidence of drugs being at their location or on them when they were summoned or questioned or arrested. So what happens to the NCB's probe? Is it all just for show? With very little evidence right now is the question. Let's say good evening to Sanjay Hegde, Senior Advocate of the Supreme Court, Ashish Dikshit, also an advocate with the Supreme Court, Fawzia Arshi, filmmaker, joins me this evening. Also, Karuna Nandi, Senior Advocate with the Supreme Court. Ashish Dikshit, let me come to you first. We've repeatedly said that this can't be the evidence to be provided in court. Now, does what Bombay High Court, what they have said today, does it weaken NCB's case right now?
See, at this stage of bail application, to give this finding whether this is a sufficient evidence or not, I think is not right in law. And if I've read the news report correctly, they have not said it is not an evidence. They have only said that this is the only material available, and in the absence of contraband being recovered, they are entitled to bail. And the important ground for releasing them on bail is the parity, that most of the accused are already on bail. So therefore, there is no purpose which is going to be served to keep this person inside jail. And as far as this evidence is concerned, it is well settled that WhatsApp conversations are not substantive piece of evidence, but yes, they are a piece of evidence which can be used for corroboration after it has been tested that there is no tampering with the chat and the chats are totally correct. Then, of course, they can be relied upon as an evidence.
But in this case, and the names that I put out from Deepika Padukone to Arjun Rampal and the others, none of them were found with contraband on them. The only link that the NCB is holding on to are some alleged chats. So doesn't it weaken their case then?
No. See, if chats are there, and if on the basis of chats there is a disclosure of commission of offence, obviously NCB will investigate. And it may not be correct to say that just because there is no seizure of contraband, the investigation should not be done. Investigation would be done, because if you see the WhatsApp conversation, it can be taken as an information. And in further investigation, NCB may find evidence and may not find evidence. But the investigation ought to be done at this stage.
Okay, let me also say good evening to Sanjay Hegde and Karuna Nandi joining us right now. Sanjay Hegde, let's begin with you. We've had conversations about this earlier as well. Now, a drugs investigation is, is different because it comes under the NDPS Act. The rules there are different than in any other case where you might be presenting WhatsApp chat as evidence. Would that be correct to say? Because for my own understanding of NDPS Act is that it's extremely important for to find the contraband on that person or on the premises.
No, the amount of contraband often determines the severity of the crime. It could be a minuscule amount or a commercial quantity, or something more than a minuscule amount, but less than a commercial quantity. So to that extent, it is important. Now, the previous speaker was correct to a certain extent when he said, and that is the position in law. WhatsApp chats per se cannot be the sole evidence. I might say anything on WhatsApp, or something can have happened to my WhatsApp account, or somebody may have put something on my WhatsApp account. I may not even have seen it, may not have responded. Just the fact that there is some kind of conversation on WhatsApp is not enough. It can be a starting point of an investigation. But for it to become cogent evidence, it can be an additional piece of evidence in addition to so many other things, which then proves the matter beyond reasonable doubt. The question before the court would be, is the accused a peddler? Does the accused deal in more than commercial quantities? To prove that, my lords, this is what we have. We have the WhatsApp evidence, WhatsApp chats on which he has participated. He has said X, Y, Z. Thereafter, shortly after that message, this amount of drugs was recovered from somewhere near his place, and so and so. So it would be how all the pieces of evidence, including the conversation on WhatsApp, all add up. Mere WhatsApp chat alone without anything else would make for a very, very tough case to prove. That is the situation.
And from what I can see, Karuna Nandi, as far as the Bollywood drugs link case is concerned, there hasn't been any large amount of seizure, any even regular amount of seizure so far, despite at least 10 big names being dragged in.
And I believe that, well, it's being reported that there will be no charge sheet filed in that case because there is enough evidence. I think it's important to remember, Tanvi, that if there is a seizure, that seizure is given a particularly privileged place under the NDPS Act. So under Section 54, if there is a seizure of drugs, then there is a presumption against the accused. So it's not that we need to see it the other way around, right? Which is that in the absence of a seizure, there's no case. It's not that. It's that if there is a seizure, that there are various presumptions that come in. Also, I think the way in which the content of the WhatsApp and the mode of the WhatsApp is being conflated is something that we can avoid. Because if the content of the WhatsApp is that I am giving you, come and pay me 5,000 rupees. I am going to supply the drugs in XYZ place, whatever, right? That is one thing. But it's important to remember, as one of the previous speakers said, that this is pre-trial. So none of this has been proven as yet, right? There are particular types of affidavits that have to be supplied. There's particular cross-examination that has to happen on all of that. And only then will the WhatsApp evidence become actually accepted evidence. And so if all there is before a judge considering the bail issue, if all there is unproven WhatsApp chat without any recovery, without any other evidence, it would be practically impossible, I think, merely to rely on that. So I think that's the way that we should be looking at it instead of the other way around.
Okay, before I go across to Fawzia, let me just bring in Ashish Dikshit. Ashish Dikshit, if that is the status, then to what extent do statements of other accused, what value will they hold in such a case? That's the other thing the NCB is banking on right now.
See, Tanvi, if you will see what is the stage of this case, the investigation is still going on. So how NCB is going to investigate and what is NCB is going to rely upon? What I, as a legal expert, can tell you that WhatsApp chat, if there are WhatsApp chat on record, it will be part of evidence to be filed in court. And yes, it may not be the substantive evidence, but it will eventually be a piece of evidence which can be used in aid to prove the case. You cannot say, and I'm also not sure whether the court has said that there is no case of evidence. The court has said there is no other material, and the court has said the main premise of granting them bail is parity, not lack of evidence, because at this stage, the court is not concerned with evidence. At the stage of bail, the court is only required to see whether there is a grave offense being committed and whether the accused is required for investigation or he may tamper with evidence. So these are 3-4 considerations which are well settled in law, which have to be considered at the stage of grant of bail.
Should be right in the
Questioning the evidence or giving a finding that evidence does not exist will not arise at this stage.
No, okay, you're right. At no point am I saying that the court has said this cannot be considered as evidence. It's exactly that this isn't evidence enough to say a certain person is a drug peddler or a drug supplier and to put them behind bars.
Tanvi, my difficulty is when a headline, like if I see your television, it says WhatsApp proof not admissible. So this is not derived out of any judicial order. This is something which is being read into the order which has been passed today.
Okay, fair enough. Point taken. Fawzia Arshi, good evening to you. Thanks for joining us. Does it now look more and more clearer that this investigation was just a lot about creating noise and that despite efforts, NCB is yet to find anything crucial against any of the Bollywood guys?
Of course. See, there are two things which are on stake and which were on stake previously also. I have been joining in a lot of debates. One is the privacy of the common man, and the other is, which is actually disastrous, and that is drugs. Here, again, I would like to say, okay, one person caught, another person is under the process of, the interrogation is going on. But who produces the drug? what is the root of the drugs, from where these drugs are coming. You know, the middlemen, the final consumers, they are absolutely wrong, yes. But my question is, who is producing, who is allowing the production of the drugs in India or anywhere in the world? But especially in India, we are so concerned that our people should not consume drugs. They should not spoil their lives into drugs and all. Then why don't we stop the production? Why don't we just slash down the root from where these catching middlemen, questioning the credibility of the people, questioning them that they are arresting people on the basis of their WhatsApp chat. See, Bollywood sells. These faces sell in the market. So people want to know more and more about it. So everybody, the media and everybody is selling these faces.
Okay, let me then pick up a point that you made and take it across to Sanjay Hegde. Mr. Hegde, and I'm not attributing any kind of motives or casting any aspersions on the intentions of the NCB, but I'm asking this question. If an investigation has been going on into various people in the Bollywood industry about the kind of drug consumption and drug commercial, selling of drugs that's taking place, by now, shouldn't the NCB have at least, reached some of these big suppliers, the giant suppliers who, provide these drugs to cities like Mumbai?
Yep.
The NCB's role was not exactly to, it was not to investigate individual cases. You are catching some kind of Haji Mastan gang or Karim Lala gang. How do you break that up? That is exactly what the NCB was supposed to be doing. Now, rather than looking at the macro levels, it has gone into a micro kind of case, as within one industry, who is it who has more than the normal user quantities, and you chase them and their grandfather, so that every day that media channels can keep putting a stakeout outside NCB offices saying which film star is coming there to receive his or her award of the day. The NCB's mandate was to do things clinically on a mega scale. As your previous speaker said, to go after the big suppliers, to go after the cartel. Here now that they've got into this micro thing, the sooner that they wrap it up one way or the other. If you find evidence of one big supplier, you going after him or her, fine. Otherwise, whether somebody snorted cocaine at one party and whether it was this quantity or that quantity, that's not the NCB's lookout.
And that is a point, a very important point that you raised, that the NCB was set up to actually crack down on these large-size cartels and these groups that functioned, that smuggled in and in large quantities were then peddling and selling these drugs. Unfortunately, what we are seeing right now, and I understand that this is NCB's gateway into the suppliers and the bigger criminals, but if they're going to stop their investigation at simply questioning the big Bollywood names, the glamorous part of the investigation, and if they don't take it beyond that, then it's going to be difficult, Karunanandi. And like you said, at some point then, WhatsApp chats will not be enough. They will have to shut down the investigation.
Yeah. I think the difficulty, Tanvi, with these sorts of actions, in addition to the media trial, and actually your channel, and you were a notable exception, but the media trial that went along with it, is that people's reputations and sometimes people's freedom has been taken away as a result. So I don't think it's just a question of what they haven't done and the fact that so far we don't see, because there have been it's been very, very leaky. These investigations have been very leaky, and we haven't seen any huge recoveries or any huge cracking of cases against peddlers or against producers, right? And in fact, there is a case in which the Delhi High Court was extremely unhappy with the alleged defamation against other channels, your competitor channels, in fact, in these very cases. So, plus, we had a situation where the 59 grams of marijuana that was recovered from Abdul Lakhani and his colleague, they were given bail immediately. And Riya Chakravarti, who was allegedly connected to them, against whom there was, from whom there was no recovery, and she was not given bail. So we've seen a situation in which not only has there been a non-recovery, and not only has there been a sort of, as you quite rightly said, involvement in a number of seemingly small cases that don't seem to be cases even now for which the NCB was set up. We've also seen a deprivation of liberty. We've also seen defamation, possibly, depending on what the court decides. But it just seems to me, prima facie, that it is possibly, very serious defamation against various members of the Hindi film industry. And they have never come together in this manner to go to court.
Of course, because when it comes to their own, they have found the will to fight back, come together and raise this issue. My only comment there, and I'm not going to sit here and pass judgments on any other media organization either, but my only comment to make is, if there is a problem with what has been shown and the WhatsApp chats that have been spoken about, questions must be asked of those who leaked it. Questions must be asked of the officials who probably knew that this is all that they have, and they still went ahead and gave that to say, well, this is our case, and this is what we are basing our investigation on, and this is why we are summoning them, which also, to begin with, is absolutely wrong.
Just to add to your point, if I may add to your point very briefly, I think in this discussion of media trials that very frequently happens, I'm on a panel tomorrow with regard to media trials. The question of leakage from the investigating authority itself very rarely gets taken up. And I think that is extremely important. Because whenever there's a high-profile case, we see and when I represented the accused in a big high-profile investigation, what you see is a huge swarm of reporters outside of the investigating authority that kind of, literally leap upon your accused and take everything that the investigating authority is leaking as breaking news. That's a huge problem because none of the evidence at that stage has been tested in court. It is completely one-sided, and because of the rush to report, at worst, the trial of the accused gets influenced, and at best, there is some defamation, there is serious defamation to their reputation.
Fawzia, I wanted to make a comment. Go ahead, please.
I want to say, as she rightly said, there's a lot of disreputation, defamation has come to this industry especially. Don't you think so that a lot of people in India are thinking that film industry is the place where drugs are happening, and that is the route from where the drugs goes in the market. The common man thinks like that by watching such shows and, watching such news and social media, this thing. Secondly, one thing more, long back, say 20, 25 years, even 30 years back, I read somewhere in a book that sometimes when we have to think, I'm leaving a question to you. I think we are under a trap of a drug industry as well, wherein the names of the drugs are being introduced like this, because even I didn't know the names of the drugs that I heard in the last 6-7 months since this is happening. And this is an introduction, or this is a kind of information, giving information to the at large, that these are the drugs more available, and those people who are into drugs will go more and buy the drugs, because they cannot promote drugs, they cannot make advertisements of the drugs and give on the news channels or on the radios or in these things. So this is a kind of a trap also. before talking about something, before saying about something, before pinpointing anybody or any society or any community, I think this is the responsibility of media and the responsible people of this country. That what are we talking and what will be the consequence?
Well, I will say that you are right to say that no industry and no set of people need to be branded as a generic sense, yes. But I don't think there should be any problem, or we should hesitate in talking about what is available out there, what could be, what your child or what your relative or loved one could fall prey to tomorrow. I think it's extremely important, in fact, on the other hand, to talk about the kind of drugs which are available, how easily they are available, especially when it comes to young little children, teenagers or youngsters who would be a lot more vulnerable to, and would get addicted to it. So instead of spicing and sensationalizing a few names that emerge from Bollywood and maybe, labeling the entire industry to say, oh, they're all into drugs, what we should do, and we do here, is to talk about the ill effects, the large, drug cartels that function, the amount of drug seizure that is taking place, but it's still the kind of drugs that are easily available, the dangers that are lurking out there, and which is what the NCB should actually be focusing on, which is what the state police departments, the state governments should actually be focusing on cracking down on those who are selling it out there in the market and destroying thousands of lives every year. Thank you so much. Completely out of time on this conversation. Suffice to say, viewers, the fact of the matter is, one more time, it has been made very clear by the court that WhatsApp chats will not be enough to call anybody a drug peddler or a drug supplier. The Narcotics Control Bureau will have to find more evidence, harder evidence, if they have to prove their case against any of these Bollywood guys or in general. Thank you so much for joining us on this conversation.